So thank you for joining us tonight. I think this is the 4th or 5th presentation I've done today on COVID-19 health and safety protocols. It's the one that I actually have the most time with, because most of these other ones I've been having to run across town to the city of Turlock, run here, run there. So I have a little bit more time with you. And the only thing impacting how long this takes is I have a sick dog at home. So I'm trying to get home to my dog who has kennel cough, which I'm pretty sad about. So again, thank you for joining us. I want to let you know that you can put questions into the question and answer spot in here, and Marshall's going to be monitoring those for me. And throughout the presentation, I'm going to stop periodically and then ask Marshall if there's any questions that came up that I need to address. So let's get started. That are here tonight shows that you have a strong interest in knowing what school is going to look like with COVID-19. I don't think any of us were thinking that the school year would start right back to where it seemed like we ended it in December. Unfortunately, it's shaping up to be an increase, and we'll talk about that today. But the good news is that we have a lot of knowledge, and we've learned a lot of lessons last year about how to make school safe for students, even in the midst of a pandemic. So we'll be talking about that today. It's helpful to understand that the guidance that I'm sharing with you is from our state. Okay, it's the California Department of Public Health, and they have both recommendations and they have mandates. Okay, so those two documents are on our website. I've also sent them out through various communications this year. I would encourage you to read them. They're a very short read. They're only about, 6 pages long, but it has a lot of information about what schools are supposed to follow right now from the state. Okay, so you can check those out. It's important to understand that the foundational principle that the state is operating under is they want full in-person instruction. They do not want distance learning. They want us to have kids here and to keep school safe for kids. So that is our goal as well. Now, sometimes things get confused, and I'm going to take full responsibility that sometimes I share things from the CDC and then people get confused, like, wait, that's different than what the state is sharing. So I've tried to dial back what I share from the CDC, because really those are just recommendations. They're not what controls what we do in our schools. Now, of course, CDC informs CDPH, but they're not always together on things, and it causes a lot of confusion. The initial CDC guidance that came out this summer did not have universal masking, and then California did universal masking, and now CDC does have universal masking. So it's no wonder that people are confused about who's calling the shots here. So our agenda today is to talk about how we're going to be handling symptoms of illness. We're going to talk about layers of prevention on our campuses to prevent the spread of COVID, what you can expect to hear from us in TUSD. I guess just to say when you will hear from TUSD, I'm not sure who TUSDS is, when you will hear from TUSD, and our COVID-19 protocols, okay? And again, you're welcome to drop questions in the chat. I'm going to pause after each one of these sections to see if there's anything I need to address. So if you had kids in in-person instruction last year, you're already familiar with our protocols for illness, and they have not changed. So a lot of stuff has changed from last year, especially with respect to quarantine, but illness isn't one of them. And so our ultimate goal is to continue to try to keep sick students home, sick staff members home, so that we can prevent the spread at school. As you know, on June 15th, the state's tiered color system went away. That doesn't mean that data isn't still being tracked. If you go to the Stanislaus County Health Services Agency, they have their own dashboard. There's vaccines, there's case positivity, there's ICUs, there's hospitals. So if you're interested in that kind of stuff and keeping it, your finger on the pulse of what's going on in the community, you're certainly welcome to check that out on the COVID-19 dashboard there. They also have different reports. This is one that came out from the period from July 11th to the 24th. Unfortunately, it wasn't a lot of good news. They are saying that they are showing an increase with the Delta variant in the number of cases. one thing that I thought, in looking at this, I'm not a numbers person, I'm more a visual person. I did take heart to the fact that, even though right now we are seeing an increase in cases, right now, knock on wood, and let's hope it stays that way, it's nothing like what we experienced back in November and December. And from everything I've read about the so-called fourth wave, they're not expecting it to look like this. So yes, we are having an increase, unfortunately, right when school's going to start. However, like we'll talk about later, there's a lot of things we're doing to make school a safe place for kids. So if you're interested, like in seeing, what tier we're in from a different type of analysis, CDC does have a COVID tracker. Of course, things have to be confusing, so their colors are all different than the ones we had, but their high or widespread transmission is the red category. And you can see, even here from the rest of the US, that most of the country right now is in that red category. So I always hesitate to talk about variants because one time someone heard me talking about variants and reminded me that I'm not a scientist, and I take that to heart. I'm not a scientist. This is the information from the CDC, who are scientists. What we know about Delta is it's 2 times as infectious as that original Alpha COVID that we had in the beginning. It can cause more severe illness than previous strains in unvaccinated persons. That's the group that people are most concerned about, is unvaccinated at this point. Fully vaccinated people, and I think in the beginning they were much more hopeful about the prognosis for being fully vaccinated. They still can get COVID. I've heard different things, but it's mainly about 10%, I believe, is what they're saying now. And we have experienced that ourselves in our COVID tracking, is that we've had some breakthrough infections. Now, the good news is what they say is it's not going to have as severe symptoms as the unvaccinated situation, or, hospitalizations and ICU visits and things like that. So this is what we're facing right now with Delta. If you went to my trainings last year, you remember I gave you a few different case studies. We're just going to show one today. This was out of Israel way back in the beginning of the pandemic, or close to it, where there was a heat wave, and they didn't mask, and they had sick kids at school, and there was no physical distancing, et cetera, et cetera. And the moral of the story, or the lesson to be learned, was these are the things not to do if you want to, keep your classrooms a safe environment. So today, we don't have physical distancing required by our state. That's why we have universal masking. But this leads me to talk about illness, right? So trying to do everything we can that if someone is sick, they stay home and don't come to school. To that end, we're going to be sending you that same daily checklist for families, asking you to take your children's temperatures or monitor their symptoms. Don't send them to school sick. And if they are ill, and we'll talk about this later, to fill out our COVID illness reporting form so that our nurse, our health tech, or whoever is going, maybe LVN, is going to call and give you some guidance on what the next steps for illness would be for your child. So this may look familiar. It's that thing we call the student symptom decision tree. I'll be sending that out through PeachJar, our electronic email communication tool. I also have a new flyer I'll send out for you guys. I think is a little more user-friendly and makes hopefully more sense for parents about, like, here's your options. Your student is sick. Here's the choices you have. So like last year, right? 3 choices. If your child is sick and they're sent to the office, or you call and let us know they're ill, they can go to the doctor for an alternative diagnosis and be back at school within 24 hours with improved symptoms and no fever. Option 2 is to get a negative PCR test. If that comes back negative within 24 hours, again, they can be back at school. And if they're sick and they don't test and they don't go to the doctor, the other option is a 10-day quarantine. We're going to be talking about some opportunities we may have for symptomatic students to test with parent consent at school, which hopefully will kind of encourage and allow us to try to keep more kids on campus and make it more convenient as a parent, instead of us telling you, you got to go, find time after work to get your kid tested. We may be able to do some of the heavy lifting on that for you with your permission. So every school website has what we call the COVID illness reporting form. So if your child is sick, if your child is a close contact, if your child is positive, please go on and fill that out. If it happens during the school day, please just try to call the school. But if it's after hours, complete it, keep your child home, and then our health tech, our nurse, our LVNs, someone will call you with next steps. Our clerical staff, when you call in, will also be inputting this information. So if you call in and say, my child's sick today, they may be asking you some intake questions so they can fill out this form. You can, cut to the chase and just do it yourself if you prefer it that way. So on every school website, this COVID reporting form is there. It is confidential. It's only monitored by our health staff. Okay, so Marshall, I'm going to pause there. Does anyone have any questions that pertain to what I just covered?
Yes, so there was one that says, if a student is vaccinated, will they be able to return sooner than 10 days?
So unfortunately, whether you're vaccinated or unvaccinated, let me go back to this little chart. Whether you're vaccinated or unvaccinated, if you're symptomatic, it still applies. You would have to either test or go to the doctor or quarantine. So you don't have to stay out 10 days. You can go test. That's one thing I was just reading last night in preparing for this. The CDC just added this. Let me see if I can find it. They just added this on August 4th. And their new recommendation is that fully vaccinated people who have a known exposure to someone with suspected COVID be tested 3 to 5 days after exposure, regardless of whether they have symptoms. So they added that for close contacts. And then the symptomatic thing has always been the same. Whether you're unvaccinated or vaccinated, if you're symptomatic, these are the things that would apply. Where the difference will be is for quarantining for close contacts. Illness, nothing has really changed. What's changed is for exposures.
Okay. Someone asked if their child has allergies, should they inform the school?
Yes. And so what you can also do is ask your doctor to write a note to that effect, that these are some of the symptoms this child may present with that have allergies. It's hard because allergies can look like COVID. But in general, that is something that, last year public health told us we can inform our parents that if these children have some kind of, condition like asthma, allergies, they can get a doctor's note to that effect. What would be nice, and we're hopeful, is that with on-site testing, that we would be able to, work with parents and our health staff to possibly, with informed consent, do testing just to rule out that it's not COVID. But you can get a note from the doctor. Mm-hmm.
And then somebody asked, just for clarification, if schools are or are not exercising physical distancing.
Yeah, so that's a good question. So we're actually going to talk a little bit about that when we get to masking. So if you can kind of hold that thought, and if I forget to emphasize that, Marshall, will you remind me?
Yes.
Okay.
And I think we're good to kind of move on now.
Okay, very good. Okay, so now we're going to talk about layers of prevention. So this is the training, the slides that I gave for our staff today. So I trained all the elementary teachers today. The principals at the secondary schools, for the most part, did this PowerPoint on their own, but the same information. And basically what we're informing our teachers, and now you as parents, is, what are those things that we're going to be doing at school to layer prevention? So we know, just like a piece of Swiss cheese, a mask is not a perfect solution for preventing COVID. Social distancing is not perfect, right? Because you might have aerosols and you can get it that way. So the goal is that, each of these things are imperfect, but if you stack up and layer enough that, one single point of failure, you'll still have some backups to help prevent the spread. So that's kind of the theory behind the things we're doing. Now, you might remember last year, especially if you had elementary students and they were at the beginning of the school year in TUSD and at the end of the school year in TUSD, that in the beginning, when we had to quarantine students, we'd have to send them home for 14 days and the whole class would go, right? And then in the spring, we kind of moved to this seating chart contact tracing, but the bad part of that was that kids were very fixed in their seats. So if we were going to use seating chart contact tracing, the kids had to be fixed in their seats, or we had to do something different, right? So we have, at this point, and this is subject to change, are encouraging seating charts. We're encouraging teachers to know where kids sit in the event of, a contact tracing investigation. We are trying to allow for those normal classroom interactions and activities with masking, right? Like we had pre-pandemic. However, it's important to note that if everyone is mixing in activities and there was someone positive, then we have to do something a little different when we go to contact trace and for our quarantine process. So I think that is important to recognize. A lot of our secondary schools are sticking with seating chart contact tracing, fixed seating, especially for secondary because they're in so many periods. So I expect, and again, I wasn't there to hear the message they gave, but from what I'm kind of hearing through the grapevine is that is what is being strongly encouraged, is that teachers, for the most part, have kids in straight rows and have them assigned to their seats. If you saw those wonderful pictures from STEAM summer school where the kids, and especially elementary, were doing all these activities, we really want to try to foster as normal a classroom atmosphere as possible. But the reality is with mixing, it's just going to be a little bit of a different quarantine message that we have to give. Again, we're encouraging our teachers to keep really good notes, who got pulled out, who was at the small table for, reading assistants, who were they sitting next to, just because if 4 days later, the principal calls and said, we had a positive, we need to identify who all the close contacts were, they can just refer to their notes and they have it right there to tell them. Okay, so I guess this kind of relates to the physical distancing question. So the CDC document and guidance, remember recommends 3 feet. In California, there is nothing in the guidance that says desks have to be 3 feet apart. What they say is that you have to universally mask. So that was the trade-off for California and their effort to get as many kids back to full in-person instruction, which we know is best, is that there would be universal masking because we can't get every single kid back with 3 feet of social distancing. Okay, so meal guidance. And so currently at this point, all meals will be in the cafeteria or they'll be outside. Those are the 2 options. Classroom eating is not allowed except if there's like a really bad air day and I don't know, inclement weather, then we're going to be at the discretion of the principal working to identify spaces where we can social distance, where we can ventilate, where we can try to reduce the capacity if we have to utilize a classroom. In general though, eating is going to be outdoors and in a limited capacity in the cafeteria with social distancing, because anytime you don't have your mask on and you're indoors, it's a different type of quarantine. And I know I keep alluding to these quarantines, it's coming. It's just very different whether you had a mask on indoors or you didn't have a mask on, okay? So ventilation, continues to be an emphasis in TUSD, and it was all the way back in the beginning when we brought our elementary students back in October. At that time, nothing in the state guidance even referred to ventilation except for like if you clean, open a window or whatever. We know now that ventilation is critical, especially because aerosols are known now as the main driver of COVID-19, not respiratory droplets. So it's important that we have these really good filters. They're called MERV 13s. It's basically the equivalent of an N95 mask in your HVAC system. We've also have an air exchange where we're having the outdoor air come in more frequently. So we're doing things on the side of that which I really don't have a lot of knowledge about, as much like variants. But the experts in those areas, which is our maintenance operations, are working to do all those things. And again, we're always encouraging our staff, open a window, open a door to at least every hour to have an air exchange. Okay, so as I was sharing when Marshall asked me the question about physical distancing, this is what the state says about masks, right? So masks best promote both safety and in-person learning by reducing the need for physical distancing. So the state has kind of put their eggs in the basket of universal masking, because if we were going to try to have to keep kids 3 feet, 6 feet apart, there's just no way we'd be able to return to full in-person instruction. Something that I feel like got totally missed, totally lost in these conversations about masks is the fact that wearing a mask indoors is going to allow our kids to stay in school. There's some caveats to that. There's some things that have to happen, but it's way different from back in October when we had a positive case and we had to send kids home to quarantine for 14 days. Okay, that time is very different now from what we get to do. And I'm super excited about it because my goal is to do everything we can so kids don't have to quarantine and they can just keep coming to school. And working with our principals and training them on like best practices. So right now for MAS and TUSD, they're required indoors at all times for students and staff, and for staff whenever students are present. Just like last year, it can be a surgical mask, it can be a cloth face mask. So they must be worn at all times indoors. Outdoors, masks are optional. I think it's important, and this is another thing that the state is much stricter on this year. We had to change our exemption guidance because last year's form had last year's guidance and this year's form has this year's guidance, which the state is saying if you get a mask exemption, like because of your mental health condition, a disability, medical impairment, something along those lines where you can't wear a mask, then you have to wear a face shield with a drape. Okay, so it's a must. It's not, if it feels good, it's a must. Now, that doesn't mean that you can't still, have your doctor sign something that says not only can they not wear a face mask, but they can't wear a face shield with a drape. But we don't have the option of just saying, okay, well, this says you can't wear masks, and so, go to class. It's a must. We must have students wear a face shield with the drape unless they're also exempted from that. And on August 6th, the state came out. Remember, I told you about those FAQs that are always changing. The state added another FAQ, and like usual, they don't tell us about it. We just happen to see it and doing all these trainings and things. And eventually it was brought to our attention, but it's a big difference now. It's a must, not a consider it. If you qualify for an exemption, we'll need to know whether it's for a mask and for a drape as well. Okay, face shield with a drape. Okay, so now let's talk a little bit about school exposure modified quarantines. If a student is in class and they're masked, but they're unvaccinated, which is most of our, obviously all of our under 12-year-olds, the student can continue attending school, not sports, not extracurriculars, as long as they are tested. It requires parental informed consent, which we have a form that we'll be sending probably by the end of the week. And the student has to remain asymptomatic, means they can't get sick. So if they get sick, then that's not going to work. We're going to send them home and recommend testing. So this is way different than anything we had back in October. As long as the student is wearing a mask, and even if they're unvaccinated, if they're a close contact and they're not sick, they can keep attending school. They will be tested by our nurses or health tech or an LVN on campus. We are meeting and getting trained by the state on Wednesday. So I'm hoping I'll be able to share when I send the informed consent information, a lot more information about what that process will look like. Like I said, we haven't even been trained yet by the state. That's happening Wednesday. Okay, so let's talk about quarantine option number 2. Quarantine option number 2, and again, these are only for school exposures. This is not something that happens at home. Those are still 10 days. We can't do anything about that. It's a 10-day quarantine. This is something that happens at school. You were exposed to someone with COVID, right? The other option is that the student is unmasked and unvaccinated. So maybe it was someone in a cafeteria and they were eating and they were closer than 6 feet for longer than 15 minutes, something like that. That quarantine situation is a minimum of 7 days. You can test after day 5. And if that test is negative, the student can end their quarantine and be back at school on day 8. So even for someone who's unmasked, unvaccinated, as long as they don't get sick and as long as they test and it's negative after day 5, they don't have to stay out that whole 10 days and come back day 11. All right. I know this is confusing, but hang in there with me. The other option is if students are vaccinated, obviously 12 and older, right? They're not required to quarantine for an exposure if they remain asymptomatic, and they must provide a copy of their vaccine card in order not to quarantine. So that's also going to be coming in the message we send about informed consent, is if you would like to proactively provide your school nurse, health tech with a copy of your child's vaccine card, we have a place to record that in Aries, so that automatically, if they're in an exposure situation, we know, okay, this child has informed consent, this child's vaccinated. they're in a different category, and then we can start working through the people that might have been unmasked or unmasked and unvaccinated. Okay, I know that's confusing. I thought I had this in this PowerPoint, but I guess I don't. Give me 1 second. Let me try to open it. Well, what I'll show you is, and if there's a lot of questions on this, oh, let me see if I can find that. There it is. What I'll tell you is I'll leave this open, and at the end, if you want me to go back and review this in greater depth, this is the training I did for our principals, because they're going to have to be the ones managing this process. I have a lot more kind of in-depth charts and things like that. So if you are still, if you're confused and you have more questions, we can go back to this at the end, and I'll try to hopefully explain it closer. In a nutshell, if you're wearing a mask, you're going to get to stay in school if you test. We're going to not test without parent consent. And then students do have to remain asymptomatic. And this is just for school exposures. And then if you're unmasked and unvaccinated, but again with testing, you can in quarantine. If you test after day 5, it comes back negative, you can be back in school day 8. Okay. So again, what we share with our staff is that we have a legal obligation to enforce the CDPH masking guidance and local enforcement practices. We'll talk about that a little bit in a sec. And I also like to emphasize to staff, like the last thing we want to happen is, you know, some kind of lax mask wearing where instead of kids getting to come to school because they weren't wearing masks, now they all have to go home to quarantine. Parents aren't going to be happy. No one's going to be happy in that situation. So we want to just encourage teachers to follow the rules and understand that any kind of unmasked situation, we are not going to be able to keep kids on campus. They're going to have to go home to quarantine. All right, so you might have heard that there was some a lot of confusion around state guidance. You know, is it a mandate? Is it not a mandate? Who's enforcing what? It is a mandate that we have indoor masking in schools. What the state left to schools is come up with your process. What does it look like? You know, where does it start? What are your rules? And that's what we did. So I have posted this information on the website. I can show you that later where it is. But in a nutshell, we have a process for elementary students that is different, as you would expect, for secondary students. We feel like a lot of with elementary is going to be just kind of education, guidance, reminders, things like that. And with high school, you know, those things will still occur, but there may have to be some, you know, more progressive interventions like we would have it in any other thing where they're not following the school rules. So what we ask is for elementary, you know, let's make sure that there is no exemption. If their parent thinks there is, let's get them that form so they can go to the doctor and have the doctor complete the exemption form. If the student forgot a mask, give them a mask. It's that simple. If they're wearing a mask inappropriately, help them learn. And that's part of the guidance for these kids that are coming for the first time, especially help them learn how to wear a mask. I'm very happy at least that we can take kids outdoors and not have to wear masks, which was just kind of a real struggle. I mean, and didn't make a lot of sense at recess last year to have to have masking. So those are gone. Maybe there'll be more mask breaks and things of that nature. So when we get to refusal, like the refusing, I think there's important to distinguish at the elementary level between someone's having a bad day, they're having a meltdown, you know, things happen, little kids get frustrated or teary or whatever. We're going to handle that different than if, you know, number one, a parent says a student is not going to wear a mask at school. That's going to be a different conversation that will probably go to the principal and may ultimately land in student services. Or if there's just this ongoing refusal, like what kind of things can we put in place at the elementary level to support this student wearing a mask, right? Or if they have a face shield with a drape. So this is kind of the guidance for TK6. And then for 712, again, same type of thing as far as you forgot a mask, give them a mask. If they're wearing a mask inappropriately, remind them, hey, you need to wear your mask, you know, over your nose or what have you. Providing that education, support, guidance on proper mask wearing. And then if they refuse to wear a mask indoors, we have this progressive intervention process that we do. So, you know, it's going to involve contact with parents, trying to work with parents to bring the student around, make sure they understand what the rules are. You know, second step might be meeting with the principal or the dean if you're at the high school. And then ultimately, if there's just ongoing, you know, adamant refusal, they're not going to wear a mask. Per the state guidance, we have to look for an alternative educational opportunity. And for in TUSD, that is independent study. So that's kind of our process. I can show you later where we have this on the website if you're interested in it. And just so you know, our primary goal is teaching kids. We want to teach kids. We want kids to come back to us and enjoy being in school. You know, we've been doing a lot of posts and we've been talking to tons of kids who are excited to be here. We hope, and then based on our experience last year, we're pretty confident that kids are going to be, you know, they're resilient. They understand, and if they don't understand, at the very least, they want to be in school, they want to be with their friends, and they're willing to do that. And because a lot of them, they suffered in distance learning. They want to be in school. So we're going to do everything we can to work with students and families to make sure that happens. Okay, I'm going to wrap up this section and then we'll stop for questions because it looks like there's a lot. We'll have in the lower levels embedded time for hand washing and things of that nature. Obviously, all of our classrooms still are equipped with hand sanitizer, so those will be in the class as well. Okay, I'm going to pause there. Marshall.
Okay, there's a couple questions. So one was, when you're referring to quarantining, is that school days or calendar days?
Calendar days.
Okay. And then there's, this might be more of a site-based questions, but there's questions coming in asking, like, if a student does have to quarantine, how are they going to get their instruction? Are they going to go like via Zoom, or are they going to get work, or what does that look like?
So we don't have synchronous learning anymore. I do know, because I was kind of looped in a meeting about this, that the computer will go home with the student if they have to go home to isolate, or if they have to go to that 7-day modified quarantine, they'll be able to take their Chromebook home. They'll be getting independent work. Beyond that, that's really Ed Services site-based question. I do know, of course, that yes, we're going to be providing assignments and work for the student to complete while they're at home.
And then this, sorry, this might be another kind of site-based question, but there's questions about physical distancing in like autism rooms and like special ed rooms, and like what that would kind of look like.
Yeah, so I'm in frequent contact with Erica Chance. She's our new director of special ed. And we're actually probably going to be doing, I don't know if it's going to be this week or next week, some additional guidance training for teachers in those situations, because obviously those classrooms, we sometimes have students who can't wear a mask because of their condition. So remember those layers of prevention. That's when we really look at different things. What can we do with physical distancing? Can we utilize a barrier, plexiglass barrier if necessary? Can we keep the door open? Can we go outside? You know, all these types of things are the types of strategies that we have to do to, and especially those classrooms, because not only them, you know, medically fragile students, there's also a lot of adults in those classrooms. Sometimes it could be up to 6, 8 people. So we're just always talking about, you know, best practices for making those classrooms as safe as possible.
And then last one, there's multiple questions kind of talking about lunch and cafeterias, and if there's going to be any type of like what the seating is going to look like, and if there's going to be any distancing, anything like that in cafeterias.
Yeah, so like I had in the slide here, all the principals are working with Jennifer Louvain, who's our director of child nutrition, to schedule, you know, multiple meal times so they can bring down the capacity in the cafeterias. They're also working to have assigned seating. So if we did have to do a contact tracing situation, you know, it would only affect a certain table. I did have last year at least 1, maybe 2 positive cases in the cafeteria, and in consultation with public health, we didn't really have to do much beyond the kids that were sitting right next to them. So with a lot of ventilation, we actually have had trainings that are in the cafeteria and have had someone that was positive, but because there was distancing, because there was, you know, open doors, you didn't have to send as many people home to quarantine because of that situation.
Okay, I think we are good.
Okay, and so let me move on. We're coming to the home stretch. So communication, when you will hear from TUSD, that's going to be the same but different, like everything else this year. So we're still going to let you know if your student was in a classroom where someone's family member had tested positive for COVID. We call those scenario 2 notifications. So you will receive those. And those are just recommended, not required by the state. The other thing that you will for sure receive is this positive case notification. It's going to be a little bit of a different process this year because we're going to send you a letter with those options I told you about. You know, if you're fully vaccinated, you don't have to quarantine. If your student was masked but unvaccinated, they can keep coming to school if they test, etc. So the letter looks a little different. And what's going to happen now is there going to be some kind of verbal discussion with you as a parent about what choice you want for your child, right? So unfortunately it is, I don't think I guess I thought I put it in this PowerPoint, but I must not have. Well, I'm on the wrong slide. How about if I go to the right PowerPoint? I thought I put in this PowerPoint, but I might have put in a different one. Let me see. Give me 1 second. Just make sure I'm on the right one. Let me close this one. Oh, I guess I do have a little bit more about that modified quarantine in here. So we'll be getting to that sooner. But the bottom line, I guess I forgot to put it in here, is that we have this new tracking system for us to keep track basically of all these different COVID situations. So you can imagine for a positive case in, like, let's say in elementary, let's start small. So a positive case in elementary, let's say there's 25 kids. We will have to, for each of those students, determine from the parents, you know, do you want your student to keep coming to school? Okay, you're giving us informed consent. Let's make sure you have that form to do that. And then this is when we'll be testing them, and this is when their tentative quarantine date ends. So there's going to be a kind of a generic letter that we send to all, but then we will follow up with much more specific questions for you as a parent so we can make the right decision about what you want to have happen for your child. It could be an administrator calling, it could be the nurse calling, it could be a health tech calling, some type of designee, but we're going to have more verbal conversations with parents than we did last year for a close contact situation. Okay, so I feel like I'm in the wrong PowerPoint. Let me just double check because I'm losing my mind here. I have like 4 different versions of the same thing. So I think I'm actually going to skip that. Oh, this is what I wanted to show you. And then we'll come back to quarantine if you still have more questions. So like I was saying, like if we have a situation where we have a positive student, we'll have to list all the close contacts here. And then we will have to figure out, you know, they don't want to test, then that would just be a regular 10-day quarantine. Okay, they do want to test and they were unvaccinated and masked. These are the test dates. This is when the tentative quarantine end date is, quarantine end date. And this is the tentative return to school date. And then if they were unmasked, unvaccinated, this would be different. So it's a lot more work, and I'm having mild anxiety, if not moderate to high anxiety. But the good news is we have a really, really, really well-trained, well-honed, experienced crew that I'm really confident in their ability to handle this. This isn't our first rodeo with COVID, and we've learned a lot about how to do this efficiently. So like I was saying, we will have free on-site testing overseen by health staff for exposed students in a modified quarantine situation. We are also exploring having both antigen and PCR testing available for symptomatic students. So remember, like we told you, you know, your student is ill, can you take them home? Here's your options. Instead of saying, okay, oh, you want to test? Okay, go to Ruby Bosch Center, go to Stanislaus. We may be able to test on site for you. So that's something we're exploring. We're going to kind of monitor what the volume is of quarantine testing. But that's something I'm super hopeful we can accomplish for parents, because I know you're busy. I know what it's like to have to try to go over to the Ruby Bosch Center or go to a drive-through and wait for 10 cars in front of you. So to the best of our ability, we're going to try to bring everything to TUSD to make it easier for you to keep your kids in school. Also, we're going to be having additional vaccine clinics for those that have students 12 and older. I believe we're planning some at the high schools, and there might even actually be a pop-up clinic, I heard, this week or next from Stanislaus County Health Services Agency. So this is from the guidance. This is not Marie Russell quoted. This is from the CDPH guidance. So one of the most frustrating things I have, bones to pick I have with the state right now, is when their guidance first came out in July, they had this quote that additional information would be coming soon about band, drama, and sports. Crickets, nothing yet. So unfortunately, I have nothing to share in that regard. I don't know if they got the memo that kids are starting school, but we do expect that to be coming. I'm hearing through the grapevine, for those of you guys that have athletes on the call, that there may not be testing this time around, even for indoor sports, but the masking is going to be much more strict. So I've heard that through the grapevine. What it looks like when it comes out, your guess is as good as mine. If you have questions and you want to get more information, there is a Safe Schools parent page on the State of California Safe Schools for All hub. I encourage you to check that out. And then, of course, you're always welcome to contact me. This is my contact information. So let me pause there, Marshall, and ask, did people understand the quarantine? Is there anything that they want me to go over those slides in greater detail one more time? Are there questions about quarantine?
There hasn't been any more. I'm just going through them right now to make sure that I'm not missing anything.
Okay.
While I'm looking, there was questions about band, but you already answered that there hasn't been any thing on that yet. And then there was a few questions about if they have a student who takes 0 period and they get a letter that there's a possible exposure, how should they kind of handle that? Should they contact the site before sending their child, or what would that kind of look like?
Yeah, so I think this is a good time to show you how that would work, is that especially if you know, before you send your child to school, they absolutely should not go to school. Every website has this form. You'll just go on, click on the link, and then, well, I guess I should give an example of a school. So let me just pick Brown. I always pick Brown because they're always first. So if I'm a Brown parent, I just go here, and then I enter all the information. Student name, Marshall made this, I believe the required fields are their names only. Oh, and their grade. So then you just, well, let me do a sample one and you can kind of see. So if you put your information in, oh man, I'm definitely making up my birth date. That's too much. And then let's say I'm in 5th grade. You would go ahead and indicate, my child has tested positive, my child has been in close contact, or my child is displaying illness, and so on and so forth, and all the way down the form. And then it ends with your name, email address, and phone number. I should say that for those of you that have children in the after school programs, if your child becomes sick in those programs, those staff, as part of their process, will also complete this form. And so if that happens, they have a whole protocol around that. They'll inform you that they filled it out, and they'll recommend that you don't take your child to school the next day until the nurse or the health tech at that school has contacted you.
And then I think this is referring to testing.
Okay.
There was a question asking, can it be verbal consent, or does it need to be written consent?
It'll be written consent. And so we have, let me see if I have it on my desktop. I don't know if I do or not. This one might be from LA, possibly. Let me see. So it'll look something like LA's, which is, it'll be in a Google form, and then we will have hard copies available where you'll put your students' information in, you'll read some disclaimers about what the testing looks like. So it will be written. And the good news is I'm probably gonna have it on the website somewhere. So if this first go around, when I send the call, you forgot or whatever and didn't give informed consent, and then when the nurse calls and says, hey, if you wanna keep your child in school, you can have them tested here with me, you could just say, okay, and then go online and give informed consent right there on the Google form. Here's an example for the modified quarantine 2. By the way, these aren't numbered in the state guidance. I can't keep track of all this stuff unless I number them. So in my mind, there's quarantine 1, or excuse me, quarantine, regular quarantine, which is those ones that happen at home. Nothing's changed on that. You still have to go home and quarantine for at least 10 days. If you have a lot of people positive in your house, it could be longer, and especially if you're not isolating. So some of our families, unfortunately, have had to deal with that. Modified quarantine 1, in my mind, is for those masked situations, right? They're masked, they're unvaccinated. And then modified quarantine 2 is for those unmasked situations. So in the first situation, everyone gets to keep coming to school because they have their masks on. In the second situation, they have to go home to quarantine, and then they can test and come back on day 8 if they're negative.
There was a question about if the PowerPoint or the information will be available somewhere after this webinar.
Yes, we're actually recording this. I regret to inform you because I'm not super crazy about being on Turlock USD YouTube, but we will record it, and I will post probably on, let me see what page I'm going to post it on. Most likely you will find this information in 2021-22 school year information. And then it'll be some kind of either on this page or in one of these drop downs. We will post it.
And then there was another question about if it's too late, if they now decide that they want to do independent study, is it too late to switch to independent study?
So that's a question for your school principal or for our independent study coordinator. Her name is Lisa Machado. I can try to write that in here somewhere. Let's see here. Let me just add her contact information. So if you're interested in, well, I don't know what the best way to do this is. Let me go to the top here. Her email, if you want to write it down, I'll just put it right here. lmachado@turlock.k12.ca.us. Her name is Lisa, L-E-I-S-A. So she handles independent study. I would recommend you reach out to your school principal and or Lisa with your request. I'm not sure where we are on that. You know, we did the survey for the commitment for a reason, because we have to staff those positions. And so those will be the folks to talk to. Any other questions, Marshall?
I'm going through and trying to find common themes. Mm-hmm. There was one that asked like what their child should do if they were sitting next to someone in class and the other students seemed like they were exhibiting symptoms, but maybe the teacher didn't see it or wasn't aware. Like, what should the student do in that case?
So I'm assuming maybe it's maybe like high school, or because like I always feel like with little kids, they usually will tell their teacher like, I don't feel good. So I think you could either let your teacher know, that they could let their teacher know, and then the teacher could follow up, or their health tech or their nurse if they had a concern.
Okay, I think I'm just scrolling through to make sure that I haven't missed anything, but I think we've hit kind of the main
themes.
Yeah.
Okay, so this is my contact information. You're welcome to reach out to me if you have some specific questions. Right now it's kind of like drinking from a fire hose with so many things in flux and moving so fast. We're going to do our best to keep you informed. Like I was saying, I think by the end of the week, my goal is to send to you that informed consent information that, if you'd like to turn in your child's COVID vaccine card, my goal is to have that by Friday. We're getting trained by the state this week. We have tests ordered. So it might take a little bit of time to get us fully up and running on modified quarantines. And so we'll have to talk about if we have a situation and we're not ready yet with all of our on-site testing, what that looks like. Is it something where we refer them to CSUS? I'm not sure yet, but our goal is to try to, as fast as we can, be up and running for modified quarantines. Okay, well, I'm going to sign off. Thank you to Marshall and Martha for being here tonight. We're excited to have you back in TUSD. I have a daughter that's a senior this year and a daughter that's a freshman this year. So it's a lot of fun for me to see them together at the same school. And, like all of you, I'm a parent, and my goal is just to have my kids have a great school year. And at the end of the day, that's all we're here for, is to make sure our kids, are happy, healthy, and are learning in 2021, 2022. Take care.